the non-communicable disease like cardiovascular diseases and diabetes are on the constant rise in India. In fact, they have overtaken communicable disease with respect to overall mortality in India. CVDs strike Indians a decade earlier than Western populations. If you really say number, 1 in 4 deaths in India are now because of cardiovascular disease with ischemic heart disease and stroke. Another major non-communicable disease is type 2 diabetes mellitus, and it is associated with significant morbidity and mortality. Type 2 diabetes mellitus patients actually are at high risk developing cardiovascular disease. Up to 46% diabetes patients will develop CVD in their lifetime, and CVD is responsible for about 50% of mortality in type 2 diabetes mellitus patients. So it is now widely accepted that the diabetes mellitus is a heterogeneous group with a wide spectrum of CVD risk, although various CVD risk scoring systems have been developed to aid CVD risk assessment over the past decade. Reliable, accurate assessment of CVD risks remain a challenge and a big problem for treating physicians. With growing burden of CVDs and diabetes, it is must that government needs to renew its focus on tackling the dual burden of diabetes and the cardiovascular diseases. Government needs to introduce advanced screening biomarkers such as NT-proBNP, which are instrumental in identifying patients with type 2 diabetes mellitus who could benefit from CVD risk stratification and actually facilitating the establishment of correct therapy management and follow-up. So, regular screening and constant monitoring of heart conditions can help CVD events, mortality, and associated healthcare cost. So this World Heart Day, let's take a pledge to educate patients and providers alike to improve early screening and bring needed shift from curative to preventive in cardiac care management. Thank you.